I'm Chantel Cargill, Mentorship Monday Committee Chair with the Women of UGA Leadership Council and a 2010 Franklin grad. On behalf of the Women of UGA, welcome back to Professional Development, Empowerment, and Intentional Connections in our virtual format. Before I turn things over to our moderator and panel, allow me to share a little bit about Women of UGA's signature program, Mentorship Monday. Established in 2018, Mentorship Mondays is a professional development series featuring notable UGA alumni. Each installment of the series offers new perspectives with keynote or panel style reflections and a concluding question and answer section. Since 2020, we have continued to provide quality networking and professional development in this virtual format. Now allow me to introduce you to our moderator, Dr. Tunisia Cornelius. Tunisia is a 2004 Franklin grad and also a board certified dermatologist and entrepreneur. Her medical degree is from the Medical College of Georgia in 2000. She obtained her medical degree from Medical College of Georgia in 2008 and completed her dermatology residency training at the University of Chicago in 2012. She opened her own private practice, Divine Dermatology and Aesthetics, in Atlanta, Georgia in 2018 and is licensed in 5 states. She recently launched Levels to Skin, a plant-derived skincare line that was co-developed with her cousin and fellow board-certified dermatologist, Dr. Kenyatta Miraku. Dr. Cornelius was a member of UGA's 40 Under 40 class of 2021 and currently serves as the Women of UGA Leadership Council as the Mentorship Monday Committee co-chair. And she's amazing, by the way. With her experience in the field, it was a perfect fit for her to moderate this discussion on empowering women through health. And I'm sure she'll reveal a bit more during the conversation. So Mentorship Monday family, Dr. Tunisia Cornelius, thank you for serving as our moderator. The floor is all yours.
Thank you, Chantel, for your kind words. Good afternoon, everyone. It's an honor to be a part of Mentorship Monday and to contribute to this legacy of having brilliant and talented women share advice with our Bulldog alumni. Before we get started, I want to remind everyone that this program is for informational purposes only and not to be a substitute for medical advice. I'm elated to be the moderator for this health conversation. And without further ado, I'll introduce our speakers and panelists, starting with Dr. Bia Atinge. Raised in Augusta, Georgia, Dr. Atinge attended the University of Georgia and graduated with her BS in microbiology in 2003. While at the University of Georgia, she was a member of the Zeta Psi chapter of Delta Sigma Theta Sorority Incorporated. She attained her Master's of Public Health from Mercer University School of Medicine in Macon. She then returned to Augusta, Georgia, and taught science at Lucy C. Laney High School for 2 years before pursuing her medical degree. From there, she earned her Doctor of Osteopathic Medicine from the Philadelphia College of Osteopathic Medicine, Georgia campus. She completed the internal medicine residency program through Morehouse School of Medicine, during which she was recognized as outstanding resident in primary care. Dr. Atinge moved back home to Augusta, Georgia in 2014, where she began work at Trinity Hospital. She is currently employed as a primary care physician with Medical Associates Plus. She is a member of the American College of Physicians, and locally, she is active with the Greater Columbia County Alumni Chapter of Delta Sigma Theta Sorority Incorporated. She works with patients from the ages of 17 to over 100 and manages chronic illnesses such as diabetes and hypertension, along with diagnosing and treating many acute illnesses. Next up, we have speaker Dr. Janella Thomas-Burse. Dr. Thomas-Burse has been practicing obstetrics and gynecology in the metro Atlanta area since 1997 and is a diplomat of the American Board of Obstetrics and Gynecology. A native of Atlanta, Georgia, Dr. Thomas-Burse received a Bachelor of Science degree in genetics from the University of Georgia. She earned her medical doctorate in medicine from Morehouse School of Medicine, where she received the Fitzhugh Curtis Award and the American Medical Association for the top student in the Department of Obstetrics and Gynecology at her institution. She completed her residency training in obstetrics and gynecology at Wayne State University, Detroit Medical Center, where she received an award in research. Having spent most of her career in community medicine, Dr. Thomas Burse has worked at all 4 of the major community health centers in the metro Atlanta area. She's also served on the faculty at Philadelphia College of Osteopathic Medicine in Philadelphia and Morehouse School of Medicine in Atlanta, Georgia. A firm believer in reaching back to mentor medical students, Dr. Thomas Burse will tell you that it's never a one-way street. She enjoys what she learns from her students as much as what she teaches. Whether she's working in community medicine, teaching, or in private practice, Dr. Thomas Burse is committed to filling the gap in healthcare disparity in urban areas. Dr. Thomas Burse is married and has 3 children. She has studied Taekwondo for many years and enjoys music, traveling, and is active in her church. Our last speaker is Dr. Uche Ukuku. As a child of Nigerian immigrants, Dr. Ukuku has desired to make counseling accessible, relatable, and welcoming for all people, especially within cultures and family systems in which it is taboo. In 2011, she graduated from the University of Georgia with a Bachelor of Science in Psychology and went on to pursue both her Master of Education in Community Counseling and Doctorate in Counseling Psychology from the University of Oklahoma in 2016. She completed her fellowship at the CARES Institute, specializing in the treatment of child abuse and trauma. Currently, she is a licensed psychologist in private practice and mental health speaker and trainer. She is also a co-founder of www.talknija.org, a nonprofit organization aimed at promoting and destigmatizing mental health in the Nigerian community. Dr. Ukuku enjoys speaking at conferences and conducting trainings to promote mental health awareness and wellness. All right, now for our program. So prioritizing women's health is important, is the paramount thing that we must do in order to empower women. Women face a variety of health challenges, both physical and psychological. And in the past, when compared to men, women have not always received equal treatment as it relates to receiving timely and effective health care. It's been said, prevention is better than intervention. Can each of our panelists touch on preventive health care as it relates to the top conditions affecting women and as it relates to your expertise?
Good afternoon, everybody. My name is Dr. Itinge. As she stated, I'm practicing in Augusta, Georgia. So, of course, being primary care, I treat men and women, but I think just the nature of it, for some reason, most of my patients are women. But of course, prevention is always key. So I always use this every day in practice because I'll see new patients that may have not seen a doctor in 20 years because everything's great, I feel fine, but that's the point of prevention. You're going to feel fine. You can have lots of things going on, you feel fine. So what I always tell patients is, even if you feel okay, you need to see someone, primary care, at least once a year. Somebody's checking your blood pressure, somebody's checking your cholesterol, because of course, the #1 cause of death, men and women, is heart disease. So of course, heart disease, high blood pressure, high cholesterol, these are things that you don't feel until something bad happens, until you have a stroke, until you have a heart attack. So we don't want you to have those things. Breast cancer, of course, starting at age 40, getting mammograms, seeing your GYN and having pap smears. So anybody who's over the age of 18, once you stop seeing your pediatrician, you need to start seeing a primary care doctor because you don't know something's wrong until something actually happens.
Hello. As Dr. Fitch said, I'm Dr. Thomas Burse. I also have to give a shout out to UGA Zeta Psi chapter of Delta Sigma Theta Sorority Incorporated. But to piggyback on what was just said, I believe there's a foundation for everything. And foundation for health and disease prevention for me are basic things that are free but yet hard to do. And as will be talked about on the medicinal side later, everything starts up here as far as what we do, our ability to do it, the motivation of whatever it is to do it, it all starts up here. But getting your sleep, at least 7 straight hours if you can of sleep a night, that's when our body rests, rejuvenates. When we say our kids grew overnight, or I gained this weight overnight, or I lost this weight overnight, it pretty much does kind of happen like that. So sleep is so important, especially for everything, but particularly nowadays, we hear a lot about Alzheimer's and dementia. So it's very important. Drinking your water, at least half of your weight in ounces, a third to a half of your weight in ounces of water a day is so important. Moving, I'm not going to say exercise. I'm just going to say moving, because you want to do something that you can sustain, that you are comfortable with, that you will want to do. So whether it's dancing with your kids around the house, going outside and playing with your kids, not just watching them play, but going out and actually being a part of the play, but things that you will enjoy that you may not consider exercise, but it's still moving. Of course, getting your, so water, sleep, movement, and a spiritual connection. I'm not going to say what your spiritual connection should be, but you definitely need that extra, we're not here by magic. So we need help. So that spiritual connection, whatever that would be. And of course, your eating, which we will talk about later on in the session. But I believe in those foundations that will prevent a lot of diseases that were just mentioned. And even in my specialty, because it hits inflammation, and inflammation is the cause of most chronic diseases. So we talk about fibroids. Everyone has heard of fibroids, polycystic ovarian syndrome, or PCOS. All of those things that you consider OBGYN, even the gestational diabetes, the gestational hypertension, very important in preventing all of that foundation, as well as one more thing I forgot, as well as stress. Stress doesn't help for anything. It causes inflammation. It's horrible, but we're all going to deal with it. But we have to figure out our ways, and that's where the mental part is going to come in, and all the other things are going to come in to help our body deal with the insults that we may cause ourselves or that may be coming from the environment.
So hi again, my name is Dr. Uche Ukuku, and so thinking about prevention, so obviously I'm a psychologist and I work kind of like through the life spectrum. So I do my specialty work is within trauma, and we even think about like, okay, how does trauma present in our life? And then it ends up impacting other ways. And so while we can't go back and change the things that have happened to us, we can examine, okay, how is it showing up in like my life right now? And so when I think about prevention, even like mental health wise, I think about it from understanding like what are our emotions and being able to acknowledge them. And so like if we don't have a foundational base of like, oh, this is what it means to me to be angry or to be sad, or even starting to unpack like what does that look like in my life and why do I have certain like judgments on certain emotions, then we don't really change like in our future. And so prevention for me means like, do I get to this place where I actually make space for understanding like my own emotional experience? Do I make space for understanding what has my background look like and how has that impacted me? And then, I think a buzzword right now that we talk a lot about are boundaries. And I think one of the reasons why we talk about boundaries a lot is because they do go along with like prevention, right? So if I have certain boundaries in my life about the people who I allow into my life, the things that I allow, like even how my work life then impacts my personal life, right? So a lot of times I think after the pandemic, we didn't really have a lot of good boundaries, like in general, but especially surrounding work. And so when we don't have those foundational like truths or those foundational boundaries, they can lead to a lot of different issues. And so prevention, I would say like in mental health, is like, I have to first like make space for it so I can understand how do I want my life to look like. Great answers. Next, we'll kind of pivot to nutrition. We know that choosing healthy food can help prevent, manage, and even reverse many health problems. With so much dietary information readily available on the internet, it can be confusing as to what kind of diet we actually need. Can you each touch on, I'll direct these to Dr. Atinge and Dr. Thomas first, but Dr. Ukuku, I'll leave a moment just in case you have some contribution on some mental contribution as well. Is there a specific diet or type of food that we need to be eating?
So I always tell people, there's lots of different diets out there. Of course, we know there's keto, there's Atkins, there's Noom, there's this and there's that. For me, it's not one framework of the name of the diet. In general, you need to stick to a high protein, high vegetable diet, low carb, low sugars, not no carb, which is what Atkins is. I don't believe in no carb diets because They are not sustainable. You're going to lose a whole bunch of weight. In the minute you put a French fry in your mouth, the weight's going to come all back. So I think it's more about eating everything in moderation. It doesn't mean you can never have carbs, you can never have sugars, because there are things you eat that have carbs in them. Corn, it's not an unhealthy thing, but it has carbs. So that's what I say. It's more about low carb, low sugar, high protein, high vegetable diet, limiting your calories, limiting your portions, and having a realistic expectation of nutrition, and especially weight loss when people are trying to lose weight. Just like Dr. Thomas Burst said, sleep has a lot to do with a lot of things in your body. I'll have patients that say, I'm going to the gym, I'm only eating 1,200 calories a day, and I'm not losing any weight, but you're sleeping 3 hours every night. You're not going to lose any weight. You're not going to lose any weight. So I think it's moderation, high protein, low carb, low sugar, high vegetables in general, not the name of any specific diet. And of course, a lot of water, a lot of water.
I totally agree with all of that. That's what I tell my patients as well. And it's confusing because there's so many diets out there. There's so many fads out there. Obviously, you know, anything that's one food you need to run away from. Yes, anybody who eats any one food is going to lose a lot of weight, but like she said, you're going to bounce right back. But it's confusing. And even when you really listen to all of the true nutrition experts that you see on TV and all the books that are out, they contradict. And so you really have to find, like in everything in life, really, is trial and error for your body. What fits you and what can you live with for the rest of your life? Because it's not a temporary thing. And I think that's another way to think about it, that I am not doing this because I have my 15th high school reunion coming up or whatever, my vacation coming up. You want to sustain it so that whatever's coming up, like what's the saying? Be ready so you don't have to get ready. So if you're doing it all the time, your body's always right where you want to be. And I don't necessarily believe in the scale too much. You know, it's a good way to monitor, because sometimes that weight will sneak up on us and you go to put on whatever you're going to put on and you can't. But as women in particular, we get so focused on that scale and so focused on whatever that it can drive us to do the fad diets and the things that we don't need to do, that's not healthy for us. Because the bottom line is health. And my mantra is focus on your health, and your body's going to go where it needs to go, where it wants to go. And then that's where we have to learn acceptance as well, that we're not comparing our bodies to whatever we're seeing, our friends, what's on TV or whatnot, because they're all struggling too. Trust me, they make it look great and easy, but they're all struggling as well. So that's when the mental part will come in as far as acceptance. So focus on health. I agree with everything that was said about the high protein, low, moderate carb. Sugar is very inflammatory. So from a health aspect, you have to be careful with adding sugar. You know, what's in the fruit, that's fine. I always suggest berries. Berries have the least amount of sugar in them, so you can pretty much have at it with the berry, whatever kind of berry it is. But a lot of the other fruit may have a lot of sugar in it. So, but especially the obvious candy, sugar, and all that added sugar, it's very inflammatory. So again, inflammation is the foundation for a lot of chronic diseases. So sugar is not the thing. It affects our ovaries. Okay, so very toxic to the ovaries. But I definitely agree with everything that was just said.
And I'll just add, I think like we as a society as a whole, but American society especially, that we have a really poor relationship with food, and like how we view food and how we view nutrition then impacts then how our body looks, but then also how we kind of move mentally. And I would say that even from the therapeutic side of it, like when majority of my practice that I see are women, and at some point we talk about body image and we talk about nutrition and we talk about like what type of impact that has on like their daily living and how they see themselves and the judgment that we put on like certain like numbers numbers and, you know, those valuations, right? So it's like, if I eat this food, like that idea that food can be good or bad. I personally don't have that belief that there's like good or bad foods in that way, because I think once we start labeling it and judging it in that way, then once we have that bad food, it's easy to make that leap to I was bad today. And then when I make that leap to I was bad today, I'm a bad person. And so it's like a very easy like spiral to go down. And so I do believe like nutrition and mental health, they definitely go like hand in hand.
Great answers. I do have a question on the guidance on alcohol intake. There's been some information that's been contradictory in terms of whether a glass of wine or two is cardioprotective versus whether or not it may contribute to dementia or cancer. Can you all speak on that?
Well, there have been some studies, I believe by the NIH, but there have been a couple of studies, specifically the difference between women and men. So part of the issue is that you can take a woman, same height, same weight, and a man, and they can have the same alcohol intake, but for some reason has worse effects on the woman, like more likely to get liver disease, more likely to have some brain damage, more likely to have heart disease, even though they have the same intake as a man of the same height and weight. So yeah, I agree. The whole cardioprotective stuff, you know, a glass of red wine every night, I don't think anybody needs to do that. Honestly, there are a lot of people that do, but and I'll give an example. I have this patient, she has one glass. Now, I believe her, she's one of those honest people, comes to every appointment, one glass of red wine every night. One. She was having some knee issues, and then she started taking Tylenol. One Tylenol, 500 every night. She had acute hepatitis. It just, her liver was just out of control. So again, it's different for everybody's body. You have to do everything in moderation, but I don't think anybody needs to have wine every night. There are other things you can do that can protect your heart, and wine just ain't, not in my opinion.
I know a cardiologist who says you can just eat some grapes, red grapes. So he's like, you don't eat that wine every night, just eat some red grapes. So yeah, I agree with that too. But like she said, we're all different. You know, 100 people can smoke and not get, 50 of them may get lung cancer and 50 of them may get cancer. So we don't know our bodies. And so you really don't want to put that to the test. And then there's also, you know, you don't know if you have addiction issues. So if somebody says, here, you need to drink this wine every night, you might be careful who you're saying that to. So totally agree. But don't, on the other hand, don't, you know, people drink. So in moderation, enjoy it, drink it slowly, and, you know, just be careful, obviously. But I think as far as that one study, you know, our compositions are different, men and women. So our body count, so we can have the same weight, same height, but he's going to have more muscle than we do, you know, naturally. In general, there are bodybuilders out there, so I'm not talking about you, but in general, the body composition is going to be different. So how we respond to alcohol and anything else is going to be very different.
All right. So vitamin supplementation is all the rage today. I take a multivitamin, a vitamin D, a probiotic, an immune supplement. Dr. Itinge and Dr. Thomas Burrs, what unique nutritional needs do women have in different phases of their life? And what vitamin supplements do you recommend for those phases?
So I do recommend everybody take a multivitamin daily. Of course, for women of childbearing years, it's recommended that you take at least 1 milligram of folic acid a day. Of course, Dr. Thomas Burrs sees these patients all the time. Sometimes that's in the multivitamin, sometimes surprisingly it's not. So that would be an addition that they would need to add. I think probably every pharmacy ran out of zinc and vitamin C during the pandemic, because everybody, people who don't even take their prescribed medicines, they don't eat, they were taking that vitamin C and zinc. So I say it jokingly, but vitamin C and zinc are actually known to help with healing. Like I have patients that'll go to wound care, they have a sacral ulcer, or they have an ulcer on their foot, and they will give them prescribed vitamin C and zinc. It's the same one you can buy over the counter because it does help with healing. And then of course, as we get older, vitamin D and calcium are two keys because it helps with bone structure and help to prevent fractures. But there's so many vitamins out there. I have people ask me about vitamins that I've never heard of before. So again, everything with in moderation, because just because it's a vitamin doesn't mean it can't also be dangerous.
Remember, supplements aren't regulated by the FDA. So that's why there are so many products out there, and it is hard to tell what's good. They say if it has the USP symbol on there, that means that company went through voluntary testing of their products for purity. What's in it is what they say is in it is in it. The amount they say is in it is in it. And again, follow directions. Directions are on there for a reason, because anything can be toxic. We drink water and we say drink a lot of water a day, but there can be water toxicity if you're crazy enough to like drink way too much. So be careful of the product you're getting. But in general, I agree. I mean, I take a vitamin D, I take a bunch of stuff, but anyway, in general, the vitamin D is like what said, is important for our bones, but it's also important for our immune system, which is why it was talked about so much once COVID came out. And for our immune system, it really needs to be on the upper level of that lab range that we get, which is called a reference range, not necessarily a normal range, but we kind of interpret that as a normal range. But it needs to be up on the higher end of it, like 70s, 80s, really, for our immune system. Under 20, it's hard for your immune system to mount a response. So vitamin D is very important. And also for inflammation, as I keep mentioning, but vitamin D is very important for inflammation. I also take a probiotic too. So D probiotic, and a supplement called DIM, which is starting to get put out there more. I'm hearing it after after you hear about something, you start hearing it more. But DIM is acronym DIM. It stands for diindolylmethane. And basically, it's a natural compound, actually, even though it sounds like a chemical, something else. But it's found in broccoli, cauliflower, cabbage, our bok choy, cruciferous vegetables. But it's important for the metabolism of our hormones. Make sure they're metabolized in a healthy pathway and not toxic to our cells. It's also supposed to be, that some small studies show, protective to our reproductive system in our breast and the prostate in men. So to decrease the risk of cancer, and it has a little, some help with the weight as well. So it's not a magic pill. You're not going to take this pill and lose 10 pounds in a week or anything like that. But if you are doing the things you're doing, it will help you. So those are like the three basic ones. But I agree with the multivitamin. And you're going to, like I said before, with nutrition, you're going to read and hear so many different opinions. Like lately, maybe 2 or 3 weeks ago, there was something on TV about, one expert said we don't need any supplements, and another one said we do. But we know for a fact that we are very heavily populated. The soil is depleted. What was in it now pales in comparison to what was there 100 years ago. So, and then with all the chemicals that surround us and the environment, our body needs help. So I'm a strong believer in supplements.
Dr. Kuku?
So I don't have too much input on the supplements. I feel like they covered it, and now I was like, oh, I need to add a probiotic and all this other stuff, which I feel like I drink kombucha a lot, but I don't know if that counts.
I love kombucha.
Unless it has a lot of sugar. And, if you drink, those smoothies and everything, you turn them over, read the label, a lot of them have way too much sugar.
Before I proceed to the next question, I wanted to clarify what is meant by in moderation when you all use that terminology.
Just in general, or about food?
I guess in general, as it relates to like food, alcohol.
I guess it depends, and I'll give an example. So in moderation, don't go to Krispy Kreme and get a dozen donuts. get one and eat it on your way home and be done with it. So it's kind of like everything, kind of like when you're growing up, and I don't even know if they do the food pyramid anymore in elementary school. Like, this part of your plate should be carbs, this part of your plate should be vegetables, this part should be your protein. That doesn't change as you get older. Like, having a whole plate of pasta with half of a chicken breast, negative. So most of that meal needs to be the chicken breast and the tomatoes or whatever else. But I overindulge. I'm overweight. I tell people all the time, I'm somebody's patient. I don't take care of myself. Every time I go to my doctor, she's like, Dr. Itinge. And she looks at my weight because I'm a patient. So it doesn't mean we're perfect. This is just our profession. We love what we do. But in moderation, it's kind of like everything you've learned growing up. When you get full, stop eating. Most of your plate needs to be vegetables and meat. Stay away from the carbs and sugars. I'm not an alcohol drinker, so that's not a thing that I struggle with. But yes, I like a lot of carbs. I've actually lost about 40 pounds over the past year. I've done zero exercise. It is clear I have just cut back on carbs, because when you know better, you do better. I can't be someone's doctor telling them to do X, Y, and Z, and I can't even do it myself. So it's just watching what you're eating in general. Yep.
Yeah, that it is a catch-all phrase, I guess, and it's relative because my moderation may be different from Dr. Ntige's moderation. So it is a relative thing, but usually we know, and you know, if we buy a pizza, we know we're not supposed to eat the whole pizza. But I think, and that's what I could have a discussion with a patient in my office. And of course, like with everything, we're all gung-ho then, but that's why I try to follow up with somebody who can help them once they leave my office. And I do have somebody I do refer to for, you know, consultation and follow up for that, because we need that continuity outside. You know, it's just like when you're full, I'm going on a diet and it's great, but then once the hunger hits, it's all out the door. So, so for that, but it is a hard term to, and I usually don't use it that much because I know we need specifics. And sometimes it's hard to give people specifics because again, our bodies are different. So we have to figure out what what's specific for you. But a low carb diet, you will definitely lose weight. And it's kind of a, Dr. Ting, it's kind of a double-edged sword. Sometimes people look at me and say, I think I don't know, I can't relate. And because I'm normal weight, but
and you do,
nobody knows
you're
anybody.
trying to eat healthy to keep that normal
Right,
weight. Yeah,
exactly. Nobody knows my struggle or anybody's struggle. So and then I tell them, you know, it's my genetics is not to, I have to fight for that. I have to work hard for that. And it is hard work. And I don't mean hard work that it's, you know, tiring, you can't do it. It just becomes repetition it will become a habit. You repeat it eventually long enough, it will become a habit. And it's not about perfection. You will fall off. You might see me out there and say, well, she's eating that. Well, okay. And I'm going to enjoy it, but, but I'm not going to keep eating. So, you know, but you got to get back on the wagon. So, and your body remembers, your body has memory. So if you've been exercising before and then you stop, your body will be like, oh, and you start back. Okay, yeah, she used to do this. I know what to do. This muscle's going to get bigger, you know, and it gets bigger faster. It knows what to do. So, and your body wants to do the right thing, but up here, we mess it up. And, you know, and that's part of life. And that's why we refer for mental health too. You know, we all need some kind of help. So we will mess it up. But the thing is, don't beat yourself up. Just say, okay, I enjoyed that Krispy Kreme, even if I did eat the whole box, but I enjoyed it. Let's move on and do better.
And I was just going to add, I think the word I try to use instead of like all the time moderation is like mindful eating. Because in mindful eating, like a lot of times when we eat, we're not actually present with our food. It's like, you know, we put on our Netflix, it's like, okay, I warm my food up, like now let me go. But in doing that, sometimes we actually miss like what we're eating. And so it's easier than to like overeat or to add other stuff. Cause it's like, I'm not even like mindful and like is my body, how does my body feel right now? Like, what is it, is it tasting good? Or is it just like, oh, I just do this all the time versus like, this is something that's good for like how I want to eat. And so I think about like mindfulness can also be applied to like how we eat in our nutrition.
Right. Nice, great answers. So different life stages are associated with specific women's sexual and reproductive health issues. Dr. Thomas Burse, can you touch on reproduction and the steps women should consider when attempting to conceive, and what steps they should take if there is difficulty?
Great question. First off, when we're trying to conceive, a lot of us participating on this panel or listening, a lot of us have had careers, or have careers, I should say, and we did all these things, including conceiving off for our careers. And then when we get ready to have a baby, we want to be pregnant yesterday. And what does that do? We get worried and we get stressed. That's not good. So number one is enjoy the moment before you have that kid. Enjoy the moments. And try not to stress about it and worry about it. And I don't tell people to go get the ovulation kit from the store, because once you start doing that, it's really hard. So that's number one. The other thing is what I mentioned before about the foundations. So I'm not going to, repeat it, but the sleep and everything, that's very important in minimizing inflammation. So when we're young, if we start those things when we're young, it's a habit. Hopefully we can raise our kids like that so they won't have to figure it out. So we need to figure it out, so we raise our kids to not figure it out. It was mentioned about the multivitamin with folate or folic acid. So sometimes people get confused because they hear both, but it's the same, folate or folic acid. And that's for when you do conceive and have your baby, that it protects against what we call neural tube defects or spina bifida, where there's a defect in the brain and spinal column. Also, taking DHA, the omega, and that's also for brain, lung, and development. So those are good things that we can take whether we're trying to conceive or not. But if we start those things young, then as we get older, when we're ready to conceive, or when those are already in place. Hopefully you're already moving, you're already doing those things, so that most of us will conceive. And usually we give it, depending on age, okay, we'll give it a good year. Every egg does not get fertilized. I do go over the menstrual cycle. I don't think we have time for that right now, but the menstrual cycle with women and the best time to conceive. I've had patients who were not realizing that, their husband drives a truck and he's out of town a lot. It's going to be kind of hard that way. But a lot of women don't really understand that. So the multivitamins, everything, then hopefully you conceive. If not, then you need to see your OBGYN, because there may be issues going on, especially like endometriosis, which is more prevalent than probably more prevalent than we know. That doesn't mean you can't get pregnant. Polycystic ovarian syndrome. I get a lot of patients who say, my doctor said I'll never get pregnant because I have PCOS. No, that is not, get that out of your mind. So, but there are things we can do for that to help you. And I have a lot of PCOS patients who get their tubes tied. They didn't really have any issues getting pregnant. So don't let that discourage you. And then we get older and we want to continue those same things into the perimenopause, which is a period where things start to change. It can happen as early as our late 30s, 40s, where people say, my cycle's not the same. It was always blah, blah, blah. And now it's not. Okay, well, it's going through some changes, but that's okay. And into the menopause and after, years, those basic foundational aspects do not change throughout the lifespan. But I think the main thing is after some time, I say if you're approaching 35 or older, give yourself 6 months. We don't want to wait too much longer because there is a biological clock, even though I've been reading, I don't know why people disparage the facts. The fact is the fact. We can't get pregnant all our lives. Men can get people pregnant all their lives, but we cannot get pregnant all our lives. So, and I see a lot of women have no problems in their late 30s, 40s, conceiving and having babies. The main issues, again, are as we get older, we are at higher risk of the diabetes, or it's starting to show, I should say. The process has been going on since we were teenagers, but when we get in our late 30s, 40s, that's when we start seeing the high blood pressure and diabetes. And that will obviously complicate a pregnancy and make it complicated to become pregnant. So again, back to the foundation things to prevent that. See your doctor regularly so that you can catch it early if it's happening to you. Like it was said before, just because you feel fine doesn't mean it's not brewing. And we want to catch it when things are brewing to hopefully be able to reverse it. A lot of things are reversible. Just because you become diabetic, especially if it's type 2, you can manage it and not have to take medications for that. So, but if you need it, it's very important to be on it so that your blood sugar is well under control should you conceive, because the baby you don't want to conceive when your blood sugar is 300. Increased risk of miscarriage, or your blood pressure is high. Increased risk of miscarriage, preterm delivery, stillbirth. So it's very important to see a doctor,
Awesome. So one topic that we often shy away from, even though every woman eventually experiences it, is perimenopause and menopause.
Yeah.
Dr. Thomas Burst, can you touch on this natural occurrence and what symptoms and health issues women may experience during these phases, as well as how to manage?
Great question. And yes, it is a natural expected occurrence. And I compare it to when we're young and we're going through puberty. There are huge changes in our bodies when we start having our periods. So it's going to be some changes when we begin to stop. A lot of young girls, we know something's happening because they start may get irritable, moody, or whatnot. But the same thing can happen on the other end. So again, like I mentioned, the perimenopause can start early, around the late 30s, 40s. It doesn't mean it's a bad thing. Everybody's different. The average age for menopause in the US is 51 and a half. That's average. So that means there are women who are younger and women who are upset and older that they're still having their period at 55 or older. But it can happen, and it's not something that's abnormal. Now, there's abnormal bleeding that we need to address for some women, but it is a natural occurrence. Typical symptoms women may have, especially early, your mood, start having mood changes, irritability, especially. Other symptoms, hot flashes, night sweats, vaginal dryness, decreased libido, and trouble focusing, trouble getting the words out. You know the words, but it's, you can't get it out. Those can be some symptoms. Now, that part can happen to anybody. But those are some of the symptoms. And there are things we can do to help with that. In my practice, and it wasn't mentioned, but I do have a private practice in the Grant Park area of Atlanta. It's GYN only. I don't see obstetric or pregnant patients, but we specialize in bioidentical hormone replacement therapy. So it's bioidentical, meaning the hormones are structured just like what our body puts out, unlike what pharmaceutical, in order for them to patent it, they have to tweak it a little bit and change it. So it's different. And a lot of the studies, the Women's Health Initiative studies and the nurse study that came out 20, 30 years ago, that scared us all off of hormones. It was very flawed. And unfortunately, when the study results came out, and I'll say results in air quotes, came out, it was on Time magazine, just plastered everywhere. But when they recanted all of that, it wasn't put out there, it was on the back real small. So women have been suffering. And we have to remember also it's cardioprotective, the right kind of hormone replacement, not the synthetic hormone replacement, but the right, and even that's not all bad, but the right kind of hormone replacement is actually cardioprotective. And what we've seen is increased incidence of heart disease since women were scared off the hormones. And like was mentioned before, the number one cause of death is heart disease, largely preventive, more common than all cancers combined, not just breast, lung, colon, but all of them combined. More of us will die from heart disease, which is again largely preventive, and our risk goes up as we get older. So, and even we can replace some hormones even before we're truly menopausal. I have some patients in their 30s, they're just getting some of it, but not all of it. When I say some of it, testosterone is very important for women. It's downplayed, it's called the male hormone, like we don't need it at all. But why do we label men the calmer of the sexes? Why are they calmer than us? And we've got this label of whatever. It's because they have a lot of testosterone. Now, we don't need as much as they do, but when we get that little whiff, we're a whole different person, a whole different person. I've had patients come in and it's almost like I hardly recognize them when they come in after we get them optimized. I mean, it's really remarkable. So I have some patients, starting in their 30s, and it will make a great transition for them. I tell them, I wish I had known about this when I was your age, but it'll make a great transition when they actually go through menopause and we add the estradiol to their regimen, and they're happy. Everybody's happy. So, but there are things we can do. Again, it may not be for everybody, but it's for the majority of us. And there's really not hardly any contraindications to it. So it will make your life a whole lot better. Even if we're older having kids, it's harder. We're a little bit more irritable, maybe a little less patient with them. But I have patients who will say their family's telling them it's time for you to go back and get whatever that is you're getting. Because everybody notices the difference. But there's a lot to say about that. We can go on for days talking about perimenopause and menopause and even pre-menopause when we're younger. But we have hormone receptors all in our body and including our brain. So it's very logical why we are mentally and as well as physically affected when our hormones aren't optimized. I'm not going to say out of balance because again, it's a natural thing for it to happen. But if we can keep them optimized, it's a whole different game.
Thank you. So before we have about 5 more minutes before we wrap up, I do want to field one question from the chat. And I'll start with Dr. Ukuku. In what ways can women advocate for themselves during office visits when they have concerns about their mental and physical health?
So I'm guessing it's like office visits to their primary care doctor. So I would start by being able to feel like, do I feel heard by my primary care physician, or do I feel heard like when I'm coming into certain spaces? Because sometimes we don't have the confidence to speak up, and it might be because of the environment that we're in, or it might be that we don't really have the words for it. And so I think it's also knowing that you can always switch providers. So whether it's in the health portion, but then also in the mental health portion. So if you have a therapist and you feel like I'm not really clicking with them, they don't really understand me, that it's okay. It's kind of like trying on clothes, right? We don't just try on one pair of jeans and like that jean didn't fit and we say, well, I'm never gonna wear jeans again. We kind of go back to the store and we keep going back and trying on different things. And so I think that's one way of trying to figure out first, like, what do you need? But then it's also a good place to like practice, like I can speak up for myself, right? So this person doesn't know me outside of this setting. And so there's not this like judgment, or I have to see them again for the rest of my life. I might be able to just say like, hey, like I've been feeling more down than usual. And so sometimes even saying the words like depressed or anxious, there's a lot of stigma with saying that. And so sometimes I just like to approach it with like, have there just been days where you feel like you don't want to get out of bed, or you feel like I can worry about anything and everything? And so being able to say those type of words of like, oh, I feel like my worry doesn't turn off, or I feel like even when I achieve certain things, I'm not feeling the same happiness that I felt before. And so those are like other ways and other words to be able to indicate that same thing of like, oh, I'm feeling more depressed, or I'm feeling more anxious, even if you're not ready to say those words, but that should be a cue into your healthcare provider that, oh, she might need more assistance here.
Dr. Tingay or Dr. Thomas first, you want to comment?
I agree with Dr. Ukuku. I say this all the time. Everybody's not for everybody, including doctors. Sometimes personalities just don't mesh. It doesn't mean you did something wrong as a patient. It doesn't mean I've done something wrong as a physician. Sometimes things just don't work. And like she said, as a patient, you have to be able to realize that I like her, but for some reason, we just don't mesh in the office. And you just have to know, sometimes you just have to find somebody else. And there's nothing wrong with that. There's nothing wrong with that. Just like you said, sometimes you got to find a new counselor. I've had people that they don't like therapists that just listen. And some people like that. It just depends. They'll go to a therapist and they want to just be cathartic and just say whatever and then get up and go home and they feel better. Other patients don't want that. They want someone who's going to give them feedback, who's going to give them homework, things that they can work on. And every therapist is different. So you just have to know what works for you. And some patients, I can just tell they need someone who's going to give them feedback. And I have some patients that they want to go talk to somebody and then get up and go home. They're not going to do the homework. They don't want the homework. They don't want the assignments. They just want a therapist. They can go sit on the couch, talk for an hour, get everything out, and then be done with it. So some of that is you just have to know, and the patient has to know themselves as well. But yeah, people should always advocate for themselves. So if it means they got to find somebody else, you as a provider, you just have to be okay with that and know it's nothing personal.
I totally agree. And, I'm not going to pretend like it doesn't bother me when a patient, leaves for, whatever reason, but all I know is I can be myself. I have to be myself. And for the vast majority, it's fine. I do like to listen to patients, and my staff is knocking on my door sometimes, like, okay, it's time. You got other people out here. So sometimes it can be a little wait, but when I turn around and give that same time to the next patient, then they're like, okay, I understand the wait. But right, you have to, if you're looking for something, in, out, I can give that to you, but you may, but you have to find what you're comfortable with. And there are a lot of providers out there. So, and I actually have people that end up coming back. So when they do leave, but it's hard for us to speak up for, and I agree, a lot of us, I will ask somebody a lot of times why they are leaving a particular provider. And sometimes it may be something real simple. And I'll say, well, they just don't know. Y'all, we don't know what the front staff is doing all the time. So if it's a staffing problem or if it's a me problem, it may be something simple, but try it. Again, for some of us, it's harder to speak up for ourselves or to verbalize things, but just hopefully you can say that, and you might be helping another person that may come in after you.
Thank you, ladies. I'm going to turn it over to Chantel to wrap up the event. We have about 5 more minutes, and we will have another session after we wrap up to answer additional questions in the chat. So please feel free to input any additional questions in the chat box. Thank you.
All right. Thank you so much, Tanisha, Dr. Cornelius, for passing it off to me. What a session, everyone. Just give a hand clap, some messages in the chat for our amazing, phenomenal panelist and moderator. Oh my goodness, I'm just so speechless of how powerful this session was. And we thank you so much for your insight and your advice. On behalf of the Women of UGA Leadership Council, thank you to everyone for attending today's session. Please save the dates for our next 2 Mentorship Mondays on October 17th and November 14th. The October session's topic is Charting a Course, a Financial Guide for Women, and November is Reviving Your Career. Both will be virtual, and the registration links are coming very soon, so please be on standby for those. I also want to take a moment to thank everyone who has supported the Endowed Women of UGA Scholarship Fund. Thanks to supporters like you, our Endowed Scholarship Fund continues to grow. The current giving total is $39,116.80. And I know you ladies can help us get that last $883 to get us to $40,000. So please join us as we continue to make impact to our outstanding scholars and help break down financial barriers to quality education, okay? Stay connected with everything UGA has to offer by visiting the calendar on the alumni website, as there are some great events coming up, like our annual opportunity to take UGA themed holiday pictures at Cookies and Cocoa with Harry Dog on Sunday, November 13th in Atlanta, Georgia. The registration will be shared to those on our Women of UGA's Insider listserv. So please make sure you're signed up. Spots will fill up fast. They always do. The link is being shared in the chat momentarily. Last pro tip, please make sure to follow the UGA Alumni Association and Women of UGA on social media on Instagram, Facebook, and LinkedIn. So at this time, we'll give those who need to depart a few moments to do so before we begin furthering our conversation. So traditionally, we separate everyone into breakout rooms, but we thought it might be better to allow an open forum so that all of our experts who will be staying on the call today, some of them have to transition, can contribute and share their perspectives. And we also think everyone attending today will be able to contribute perspectives and experiences as well. That will be helpful to other women. On behalf of Women of UGA, again, thank you all so much for attending. And of course, as always, go dogs.